Hello, my name is Tyna. I'm going to be assessing you today. And can you tell me your name?
Michelle.
Okay, and can you tell me your age?
20.
And do you know where you are?
Yes.
Where are you?
I'm at your apartment.
Okay, and can you tell me the month and the year?
December 2013.
Okay, and the patient is alert and oriented times 3. She appears her stated age. Her skin tone is even. I don't see any obvious deformities, no lesions. She looks appropriate for her ethnic background. Her nutritional status, her weight appears within normal limits for her height and build. Her body fat is evenly distributed, and her posture and position seems relaxed. She's erect. And her facial expression is also relaxed. As you can see, when she walked in, her walk was smooth, even, and well balanced. She had a steady gait. She had no assistive devices. The movement in each joint were smooth, accurate, and coordinated. Her mood and affect, she's cooperative. She appears comfortable, and she interacts with me pleasantly. Her speech was very clear. It was coherent, fluent, and it was even spaced, and she had appropriate words for the situation. She also did not have any hearing impairments. She knew everything I was saying, and she could hear me. As for her personal hygiene, she appears clean and well-groomed. Her hair is brushed, and her makeup is appropriate. And now I'm going to go ahead and assess her skin and nails. So can you just hold out your hands? Her skin is smooth, bilaterally. She has good capillary refill, less than 3 seconds. Her nail folds are smooth and rounded. And the surface is also flat. Her skin temperature is warm bilaterally, and it's equal throughout. She has no visible diaphoresis, and her mucous membranes and they are moist and pink. I'm going to go ahead and check her turgor. And she has very good turgor. It's easy to rise, and it goes right back. And as I can see, there are no lesions in her body and no deformities. I'm going to go ahead and assess her head and scalp. Her head is normal cephalic with no unusual lumps or deformities. Do you feel any pain? Also no tenderness to palpation. And now I'm going to assess her cranial nerve 7. Her eyebrows are symmetric. Can you smile for me? And frown? And puff out your cheeks. Good. Okay, and now I'm going to assess her temporal pulses. And they are present and bounding. I'm also going to assess for her temporal mandibular joint function. So if you can go ahead and open and close your mouth. And it's very smooth. There's no clicking. Do you have any pain? And no tenderness. I'm also going to go ahead and palpate her sinuses. Any pain? Any pain?
No.
And no tenderness on her sinuses. Okay, I'm going to go ahead and assess her eyes. Can you cover one of your eyes and tell me whenever you see one of my fingers, okay?
No. No. No.
Okay, and the other one?
No. No. No.
Okay. Now I'm going to go ahead and assess her corneal light reflex. Okay, and just look straight ahead. Okay, and I can see that her eyes are symmetrical, and her pupils are round and reactive and equal to light. She has no abnormality or lesions on her eyes, her upper eyelids, and her lower eyelids. You could close your eyes. They close together nicely and they don't overlap. I don't see any redness, no swelling, no discharge, and I don't see any sunken appearance on her eyes. Okay, and I saw that her conjunctiva was clear, her sclera is white, and like I said, her pupils are round, regular, and equal in size, and right now I can see they're about 3 millimeters. Okay, I'll go ahead and switch this off. Okay, go ahead and look straight ahead. And I could see that her disc was creamy yellow, round, and it was very distinct. Her vessels decrease in size as they extend to the periphery, and there are no torsions or any twisting of the vessels. Her retinal background is also light red, and there are no lesions present. Okay, I'm going to go ahead and assess her ears. Alright. Now I can see that both ears are equal in size bilaterally. The pinna and the tragus are freely movable. Do you feel any tenderness? And there's no tenderness. Okay, I'm going to go ahead and look inside your ear. Okay. Her tympanic membrane was intact, and I could see that it was shining and pearly white. And also I could see the cone-shaped light. Okay, I'm gonna whisper 3 words, and you're gonna tell me what they are, okay? And while I do that, I want you to hold your finger to your ear and move it up and down. Okay? Okay. Window. Fish. Tank. Okay. And same on the other side. Window. Candle. Pillow. Okay, very good. Okay, let's go ahead and assess the nose. Just by looking at her, I can see that her nose is symmetric and midline. It's proportional to her facial features. And go ahead and close one of your nostrils and just breathe in. And same with the other side. Okay, and there's patency in both her nostrils. I'm going to look inside your nose. Okay. Okay. The nasal mucosa was red, smooth, and it had a moist surface. There was no septal deviation, perforation, or bleeding. And also her turbinates were the light red with no swelling, exudates, or polyps. Okay, go ahead and open your mouth for me. And stick out your tongue. Build up your tongue and move it from side to side. Okay, stick out your tongue and say aw. Okay. Okay, I was looking at her teeth and gums, and they're straight, evenly spaced, they're clean. Her gums are pink, there's no swelling. I also looked at her hard palate, which was light pink with irregular transverse rugae, and also her soft palate, which was a little darker pink and also smoother. Her tonsils were grade 2, and her uvula was midline, and it rose when she said ah. And her tongue also protrudes in midline, and there are no tremors. Okay, I'm going to assess your neck. Okay, I see that the skin is evenly toned throughout. There are no lumps or any obvious deformities. I'm going to feel her carotid pulse. Okay. And I feel them bilaterally. I'm going to go and assess her lymph nodes. So this is a preauricular, postauricular, the occipital, the submental, the submandibular, the superficial cervical, and the jugulo-digastric. The deep cervical chain, the posterior cervical chain, and the supraclavicular lymph nodes. And I did not palpate any of them. And did you feel any tenderness? Okay. Well, I'm going to go ahead and listen for if there's a bruit on your carotid. So just take a deep breath and hold it. Okay. I do not hear a bruit. And now I'm going to look at her trachea, and it's palpable and it's midline. And I will go ahead and assess her thyroid. Okay, can you lean your head to the right side and down? Okay, now swallow. Okay, good. Now to the other side and swallow. And her thyroid was non-palpable. Okay. I'm going to go ahead and assess her chest and her lungs. Okay. And I can see that her thoracic cage has an elliptical shape. I'm going to put her shirt up a little bit. Okay, it has an elliptical shape with downward sloping ribs, and the anterior posterior diameter here is less than the transverse. Her skin is even throughout. Also, there are no paler or any lesions, and it's also symmetric. Okay, go ahead and breathe. Okay, and as she does that, my thumbs move outward symmetrically and bilaterally. Okay. So every time now that you feel my hands touch your back, just say 99. Okay?
99.
Yep, 99. Okay, and I felt tactile fremitus throughout. And did you feel any tenderness? That, and there's no lumps or any tenderness. I'm going to look at her spine. And that is also midline. I'm going to go ahead and percuss her lung fields. Okay, and these sounds were resonant throughout. Now I'm going to check for her diaphragmatic excursion. Okay, take a deep breath and just let it out. Okay, go ahead and breathe. Now take a deep breath and hold it. Okay, and I can see that it's about 2 centimeters. And I'm going to go ahead and do it on the other side. So take a deep breath and hold it. Or just let it out, I'm sorry. And hold that. Okay. Now take a deep breath and hold it. And I can also see that that's about 2 centimeters and they're equal bilaterally. I'm going to go ahead and listen to her lung sounds. Actually, before I do that, I'm going to check your CEA to see if there's any tenderness. And just let me know if it hurts, okay? Okay. Yep. All right. Now I'm going to listen to her breath sounds. And every time my stethoscope touches your back, just take a deep breath. Okay, and her breath sounds were clear. There are no adventitious sounds. I can see that her respirations are also regular. And if you could turn and face me. Okay, and I'm going to touch my wrist to your chest and just say 99 whenever you feel that, okay?
99. 99. 99.
Okay, and there is also tactile fremitus throughout. And I'm going to go ahead and percuss your lungs. And the sounds are resonant throughout. And let me just listen to your lungs. And take a deep breath. Okay, and her lung sounds were clear and there are no adventitious sounds. Okay, now let's test your range of motion and your muscle strength. Can you go ahead and lift your arms up like this? Okay, and put it behind your back like this, and behind your head like this. Okay, and go ahead and bring it up. Okay, so I can see that she has full range of motion. And let's go ahead and test your strength. So just push against my hand. Okay, she has good muscle tone. And you got my hand. And now I can see their non-palpable epitropier nodes. Okay, now if you could lay down for me. And just put these pillows under your head. Okay. Now I can see a jugular venous pulse. So I'm going to go ahead and see what the venous pressure is. Okay, and I can see that this is about 2 centimeters. Okay. And I'm feeling now for precordian pulsations, and I can feel a pulse but no heaves. I'm going to listen to her apical pulse in the 5th intercostal space. Okay, and her pulse is regular. I'm also going to listen to your heart sounds. And I can hear S1 and S2. Okay, have you voided before you started this assessment?
I did.
Is your bladder empty?
Yes.
Okay, great. Now I'm going to take a look at her abdomen. As I can see, it's flat. Her skin is smooth and even throughout. There are no lumps and no deformities. No lesions or scars either. And I can see that her umbilicus is midline, and I cannot see an aortic pulse on her abdomen. Okay. I'm going to go ahead and listen to her bowel sounds. And her vowel sounds are active in all 4 quadrants. I also did not hear any vascular sounds while I was listening. Okay, let's go ahead and percuss. Okay, and there's tympani in all 4 quadrants. Okay, I'm gonna check her liver scan. Can you hold up your breast? Okay, and I can see that it's about 6 centimeters. going to go ahead and do some light palpation. Do you feel any tenderness?
Mm-mm.
Okay, so I'm going to go ahead and do some deep palpation. And her abdomen is soft. I don't feel any lumps or any of her organs. I'm going to go ahead and try and feel for her liver. So if you could just take a deep breath and let it out. Okay. Now take another deep breath. Okay. Now you can let it out. And her liver was non-palpable. Okay, I'm going to go ahead and let's do it on this side. Percuss for her spleen. Okay, take a deep breath and let it out. And there are no changes in sound. The sound was dull. Okay. And I'm going to go ahead and try and feel for her spleen. So just take a deep breath. And I cannot feel her spleen. And I also cannot feel any kidneys. Okay, I'm going to check your femoral pulse. So just, you can move up in the bed a little bit and straighten your legs. Okay. And I do feel a femoral pulse, +2. I feel some inguinal nodes, but they are movable, and do they hurt when I touch? And they're non-tender. Okay. Now for her lower extremities, I can see that both legs are symmetrical, they're equal in size, and her hair is evenly distributed. Her skin is also even toned, and there's one bruise on her right leg, and other than that, her skin tone is even. I'm going to check her popliteal pulse. So just lift up the sacrum. Okay, I can feel a pulse, and it's a +2. See her posterior tibial pulse. And that is also a +2. Her dorsalis pedis. A little harder to feel, +1. And I can see that her temperature is warm. I can feel that it's warm bilaterally, and it's equally distributed. Her toes look clean, well groomed, no scars, no lesions, no lumps, and she also does not have any edema. Okay, you could just sit up for me. Okay. Can you lift up one of your legs like this? Okay, and out, and back in. And same with the other one. Okay. Can you push against my hands? Okay, and back. And feet. Okay. I can see that she has good range of motion, good muscle strength. She has full range of motion on her hips. Okay, now close your eyes and tell me whenever you feel, just touch your face, okay?
No.
No. Mhm.
No. 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 No.
Okay. She has sensation throughout her body. I'm going to give you an object and put it in your hand, and you just tell me what it is, okay? And keep your eyes closed.
It's a key.
Yep, good. Okay, now open your eyes and touch your finger to your nose like this. Okay, and faster. Good. Now, go ahead and touch your nose and to my finger, okay? So, yep, good. Okay. She has good cerebellar function. Can you touch your heel to your knee and then just move it down your leg? Yep, and same with the other leg. Okay, and let's go ahead and test her deep tendon reflexes. Okay. Yeah. Bend it and just relax. Okay, good. Okay, good. Good. Alright, and the toe. Alright, and her deep tendon reflexes are all intact. The biceps, the brachioradialis, the Achilles, which may be the Achilles. Alright. Triceps and her patellar. Now I'm going to go ahead and assess for Babinski reflex. Okay. And you can see that her toes do not fan out, and that's normal for an adult. Okay, just get up for me. And can you walk across the room just to the wall and back? And as she's doing this, I'm assessing her gait. And she has a steady gait, full range of motion. Can you walk on your heels? Okay. And then just walk back on your heels. Okay. Now can you walk from heel to toe, all the way down and all the way back? Good. Okay. She also has a steady gait and balance when she's doing that. Now I'm going to test for her Romberg sign. So just close your eyes. Put your arms straight out in front of you. Okay. And I don't see any deviation or loss of balance. You can go ahead and put your arms down. Now we're going to do the shallow knee bend. So just lift one leg up, and dip. Good, and the other leg. Good, and dip. Okay. Now if you could go ahead and touch your toes. Good. And just twist like this. And as she's doing this, I'm assessing for her range of motion on her spine. So just move back and forward, and she has very good range of motion on her spine. Okay, and that's it for today. Thank you so much for your time, and I'll see you next visit.